segment is sponsored by Springfield Clinic. For today's Wellness Wednesday, we have Lori Hanson here, a diagnostic imaging manager with Springfield Clinic, to discuss mammograms. Lori, good morning to you.
Good morning, Brittany.
Now, we all know someone who has possibly personally been affected by breast cancer. So why is it so important just to make sure that you schedule that mammogram?
Well, Brittany, just with anything, it's early detection is everything. The sooner we can catch something while it's small, the more manageable it is, the more highly treatable it is.
And you talked about early detection. Can you elaborate a little bit on that and why it's so important to catch that early?
It's so important because not only does that greatly increase risk or chance of survival, but it also really minimizes the kind of the harder treatments that you would have to go through to treat it. So
talk about the age range a little bit. Do you see this more common in women 30 and up, 40? Talk about the age range for us.
Well, the American College of Radiology and the Society for Breast Imaging recommend age 40 and every year after that, unless there's a strong family history of breast cancer at like a younger age, then they will recommend getting, starting earlier. But that's something to discuss with your patient's provider.
And has the way that you go about mammograms, has it changed since COVID-19?
We are very safe here at the clinic. Our patients are triaged at the door. We call them before they come in, make sure they have no symptoms. The staff as well is triaged every day before they come in. They don't come in if they're sick or any symptoms at all. And then of course there's universal masking. The staff wears masks, the patients wear masks. So it's very, very safe.
And Lori, some people at home may be wondering, do you have to get a COVID-19 test before you come to the clinic?
No, you do not. We do ask if you're sick, then you stay home and talk to your provider about that. But we also call patients a day or two before, and just make sure that they don't have any symptoms before they come in. And if they do, we just encourage them to talk to their provider and let their provider determine if they need testing.
For sure. Now tell us really quick, where and what locations can those patients get mammograms?
We do mammograms Monday through Friday at 800 North 1st Street, 900 North 1st Street, and main campus on 6th Street there.
All right.
And then we do offer Saturday mammograms from like 8 o'clock to like noon at this time.
Okay, perfect. Lori, so much valuable information, especially with this being Breast Cancer Awareness Month. We want to spread that awareness as much as we can. So we really appreciate you for being with us.
Oh, thank you, Brittany.
All right, have a good one.